Hi everyone, and thank you for joining us today. We are a group of students from Purdue University within the Department of Health and Kinesiology, and in this presentation we'll be discussing a critically important topic for anyone pursuing a career in emergency medical services: drugs and alcohol, its effects, signs of addiction, and interventions or recovery. As future EMRs, it's vital to recognize how different substances affect the body, the signs of addiction, and how to approach someone who might be struggling. Throughout this presentation, we'll explore different categories of drugs, their medical and illicit uses, signs of substance abuse, and what recovery and intervention methods can look like. Our team, Ava, Cutis, Andrew, Aryan, Ali, and Libby, have divided this topic into focused sections to make it clear and easy to follow. So let's get started. Now, let's start by defining what drugs are. In the simplest terms, a drug is any substance that changes how your body or brain works. Some drugs are legal, like those prescribed by a doctor or sold over the counter, while others are illegal or misused. People use drugs for different reasons, like medical treatment, recreation, or even to cope with stress or pain. But it's important to understand that depending on the drug, the risk of becoming dependent or addicted can vary greatly. Drugs are often grouped into categories based on how they affect the brain and the body. So first we have depressants, which slow down brain activity and can make you feel relaxed or sleepy. Examples include alcohol and prescription medications like Xanax. Then next are stimulants, which do the opposite. They increase alertness and energy. These include drugs like cocaine, meth, or medications used to treat ADHD. Then we have opioids or narcotics. These are powerful painkillers like morphine or heroin. They can create intense feelings of pleasure but are also extremely addictive. Now another thing with heroin, and opioids in general, is that the first time you use them is when people achieve the best high they possibly can, so that every time they go back to using those drugs, then they continue to try to reach that high but can never actually get there. Moving on to other categories such as hallucinogens or drugs that distort perception and make people see or feel things that aren't really there. LSD and magic mushrooms are common examples. Then you have cannabis or marijuana, which is kind of unique because it can act as a depressant, a stimulant, or even a mild hallucinogen, depending on the strain and the dose. Lastly, we have inhalants. These are chemicals found in products like glue or paint thinner, and when inhaled, they can create a quick high, but they're extremely dangerous and toxic to the brain. The terms opioids and narcotics are often used interchangeably. The term narcotics is a generalized term that refers to painkillers that lessen the senses, which includes opioids. So all opioids are considered narcotics, but not all narcotics are considered opioids. Narcotics are drugs that have the ability to produce pain relief, drowsiness, addiction, and sometimes euphoria. Opioids are a class of drug that derive from natural substances that produce a variety of effects, including pain relief and euphoria. Opioids can be prescribed for post-surgical pain or severe pain from trauma or disease. These drugs can also be used with the purpose of feeling euphoric, and even under doctor supervision, opioid use can pose risks, like addiction, tolerance, and dependence. Opioids can become addictive, which is known as opioid use disorder. Regular use of any prescribed medication can increase a person's tolerance and dependence on this drug. So when helping someone using opioids or narcotics, ensure you're using a non-judgmental and supportive tone to make them feel safe and heard. Now, have you ever wondered what the most commonly abused drugs are and how they affect the body? In this slide, we'll explore the main categories of drugs being abused worldwide. So let's break it down by group. So first we have central nervous system depressants. So for our first group, opioids. The most common opioids include heroin and morphine. Other examples are codeine. Group B, you have sedative hypnotics, right? They include ethanol or alcohol, benzodiazepines, and rofinol. Other examples are barbiturates, which are high-risk sedatives compared to non-barbiturate sedatives. For central nervous system stimulants, most common used drugs include cocaine, methamphetamine, also known as ice, and other stimulants include amphetamines. Hallucinogens, also called psychedelics, include LSD, DMT, and PCP. Other examples are ketamine, psilocybin, and mescaline, found in the peyote cactus. Cannabinoids. The most common are hashish, cannabis, marijuana, bang, and weed. Synthetic cannabinoids like voodoo and strox are also included. Inhalants. The most abused are solvents like glue and paint. Others include nitrous oxide, often called laughing gas. Other types of abused drugs include a mix of substances that don't nearly fit into the other groups. Examples include over-the-counter cold medications with dextromethorphan, anabolic steroids, and anticholinergics. These may come in tablet form. While some are used medically, many carry risks of misuse and addiction. Now let's explore the different ways that drugs can enter the body. These are called routes of administration, and they influence how quickly and intensely a drug affects the brain and the body. The most common familiar method is oral intake, which involves swallowing a drug in a pill, capsule, or liquid form. It passes through the digestive system before reaching the bloodstream. Although it takes longer to take effect, it is often considered the safest route. Injection delivers drugs directly into the bloodstream using a needle. This method causes an almost immediate effect. However, it carries significant risks, including infection and collapsed veins. Snorting involves inhaling a powdered substance through the nose. It allows the drug to be absorbed through the nasal mucosa and into the bloodstream, creating rapid effects often within minutes. Then we have smoking, which involves inhaling drugs in a vapor or smoke form. The drug enters the lungs, is quickly absorbed into the bloodstream, and rapidly affects the brain often within seconds. Now let's look at inhalants, which are the vapors from toxic substances that are able to produce this high. They often used are shoe polish, glue, gasoline, spray paint, cleaning fluid, poppers, and nitrous oxide. Then we have cocaine, which affects nearly 1.5 million people in America. And they're very familiar with this as white powder. Marijuana is the third most popular recreational drug in America and the number one most abused illicit drug. Then we have heroin. Heroin is made from the resin of poppy plants and is a highly addictive form of opiate. It is mainly prescribed as a painkiller or analgesic. Methamphetamine, meth, crank, or speed is a popular drug for parties and nightclubs as it produces feelings of well-being and energy lasting for 4 to 16 hours. Hallucinogens. Although hallucinogens include half a dozen or more drugs such as PCP and ketamine, LSD is by far the most popular. Another name for LSD is also known as acid and is one of the most potent hallucinogens in the world. Then we have ecstasy. MDMA, or the love pill, is one of the most popular drugs among youth today. Drug use effects vary depending on the type of drug used. Opioids and narcotics are considered depressants. Common effects include pain relief, drowsiness, euphoria, slowed breathing, pinpoint pupils, nausea, vomiting, and constipation. Some of these effects, such as respiratory depression, pinpoint pupils, and vomiting, can be dangerous and potentially life-threatening. Fortunately, these effects can often be reversed with the administration of Narcan. Stimulants such as cocaine and methamphetamine can increase energy, alertness, and talkativeness. They also create a sense of euphoria. Additional effects include dilated pupils, increased heart rate and blood pressure, and decreased appetite, which can lead to weight loss. Stimulant use may also cause paranoia, aggression, hallucinogens, and a severe crash or emotional low once the drug wears off. So now let's go over some of the signs of drug abuse, both physical and behavioral, that you might notice in someone who's struggling. Starting with physical signs, for opioids and narcotics, you often see things like pinpoint pupils, drowsiness, and slowed breathing. If the person is injecting the drug, you might also see track marks on their arms or other parts of their body, as seen in the photo above. Stimulants like cocaine or meth can present differently. These drugs can cause dilated pupils, extreme energy or restlessness, noticeable weight loss, and sometimes poor skin condition, including those track marks, from either scratching or even just a lack of hygiene. When it comes to behavioral signs, someone using these drugs might show mood swings, paranoia, or even aggression. You might notice them neglecting responsibilities, whether it's at work, school, or home. They may also be facing financial problems, especially if they're spending excessive money on these substances. Finally, one of the biggest red flags is secrecy or social withdrawal. They might stop spending time with friends or family and isolate themselves from the people who care about them. If you notice a combination of these signs, it could be a sign that someone needs help, and stepping in with compassion could make all the difference. Oftentimes, when someone is addicted to a drug, they experience cravings and dependence, which means they need more of that drug to feel normal, and they experience withdrawal symptoms when they are not using that drug. So what is Narcan? Naloxone, more commonly known as Narcan, is a life-saving medication used to reverse opioid overdoses. It works by quickly binding to opioid receptors in the brain, effectively blocking the effects of opioids and restoring normal breathing. Narcan can be administered either as a nasal spray or through an injection, and it's safe to use even if the person is not actually experiencing an overdose. There are no serious side effects from giving it to someone who doesn't need it, which makes it a crucial tool in emergencies when you're unsure. However, it's important to understand Narcan only works on opioid overdoses. It will not reverse the effects of any other substances, like cocaine, methamphetamine, or any other drug. When you're trying to help someone who may be struggling with drug use, the first step is to talk to them in a non-judgmental and supportive way. It's critical that the person feels safe, heard, and respected. This builds a foundation for trust. Once you've established that rapport, you might consider staging an intervention, ideally with the help of professionals like therapists or addiction specialists. These experts can guide the conversation and connect the individual to proper resources. If they're open to help, encourage them to seek medical detox or a rehabilitation program. Withdrawal can be dangerous, especially from opioids or alcohol, so medically supervised care is key. There are many different paths to recovery, and the best one depends on the individual. Here are some common and effective options. Medication-assisted treatment, or MAT, is especially helpful for opioid addiction. Medications can help manage withdrawal symptoms and reduce cravings. Therapy and counseling also play a huge role in recovery approaches, like cognitive behavioral therapy, which can help people understand and change the patterns behind their addiction. Support groups like Narcotics Anonymous or Smart Recovery offer a sense of community, accountability, and peer support. Rehabilitation programs can be inpatient, where someone lives at the facility for more intensive care, or outpatient, which allows them to maintain daily life while getting that treatment. And finally, these are harm reduction strategies. These include things like supervised injection sites where people can use drugs in a monitored, safer environment, and needle exchange programs, which help prevent the spread of infectious diseases like HIV and hepatitis. Alright, now we'll be diving into the topic of alcohol, the effects it has on our bodies, and the risks associated with drinking. While alcohol is widely consumed, it's essential to understand both its immediate effects and the long-term consequences of its use. So let's break it down. At its core, alcohol is a depressant. This means it slows down the central nervous system, which affects our brain and our body. When consumed, alcohol creates a temporary feeling of relaxation and euphoria, but it can also have a wide range of negative effects, especially when abused. So let's take a look at the short-term effects. Mild consumption, not as bad. You might experience feelings of relaxation and lowered ambitions. You might feel more sociable, and your reaction time might slow down. Then with heavy drinking, we get into more serious symptoms, such as slurred speech, nausea, and loss of coordination. Eventually, you might even black out or forget parts of the evening. Severe intoxication. If someone consumes an excessive amount, the effects can be life-threatening. Alcohol poisoning can occur, causing unconsciousness, slowed breathing, and even death if they are not transported to a hospital. Long-term effects. You have liver damage. This is one of the most well-known long-term effects. It could range anywhere from a fatty liver to cirrhosis, which is a condition that severely impairs your liver function. Brain damage and memory loss. Chronic alcohol consumption can also have lasting effects on the brain, leading to these memory problems and cognitive decline. Heart disease and high blood pressure. Alcohol increases this risk, which can lead to stroke or heart attacks. Increased cancer risk. Long-term alcohol use is associated with an increased risk of various cancers, including liver, breast, and mouth cancer. And a weakened immune system. Drinking too much alcohol can suppress the immune system, making it hard for your body to fight off these infections. There are several common types of alcohol that people consume. These often include beer, wine, and liquor. Beer is usually between 4 and 6% alcohol, and it's the most common alcoholic beverage that's consumed in very large quantities. Wine, on the other hand, has a higher alcohol content, usually between 12 and 15%, and it's often enjoyed with meals. Then you have liquor, which includes beverages like vodka, whiskey, rum, among other types of alcohol, which have the highest alcohol content, generally around 40% or higher. These are often consumed in smaller quantities due to their potency. Each type of alcohol affects the body differently. As you can see with this chart on the right here, you have a BAC chart for male and female, number of drinks consumed, and where their BAC will be at, and if they are able to drive or not. It also shows what level is safe for driving, outlined in the green. Then you have the yellow, which means that it impairs the driving, and then the red, obviously, you can't drive at all. So it's a really good chart right here to kind of outline how many drinks you should have and kind of where you think you'll be if you don't have access to a breathalyzer. Then we have the different levels of alcohol use, right? So you have normal, binge drinking, heavy drinking, alcohol addiction, alcohol poisoning. Now, normal is 1 to 2 drinks in a 24-hour period, right? This is generally what most people do. Then we have binge drinking, which is anywhere from 4 to 5 drinks in a 2-hour period. Now, the problem with binge drinking is that when people do it once, they may do it multiple times over, and that's where it leads to all those other complications. Then we have heavy drinking. Heavy drinking is defined as drinking a high amount of alcohol regularly. For men, it's 15 or more drinks per week, and for women, it could be 8 or more drinks per week. This level of drinking significantly increases the risk of liver disease, mental health problems, and addiction. Then, moving up from heavy drinking, we go into alcohol addiction, which is the combination of binge drinking and heavy drinking over multiple weeks. Signs of these addiction, right, could be increased tolerance. Over the time the body builds that tolerance means they're able to drink more to achieve those same effects. Then you have withdrawal symptoms. If you stop drinking suddenly, you might experience withdrawal symptoms like shaking, nausea, and anxiety in very severe cases. Neglecting responsibilities. Drinking often interferes with people's daily lives, neglecting work, school, family responsibilities, and things like that. The inability to stop. Even when the negative consequences of drinking are clear, someone with alcohol addiction may find it impossible to quit. And then risky behaviors as well. This may lead to them driving under the influence, like that chart we looked at on the last slide, or getting into financial or legal trouble. Finally, then we have signs of alcohol poisoning, which is the most serious case that can lead to death. This is where the BAC is so high that parts of the brain start to shut down. But this could be person dependent on how long it takes for them to reach that. Alcohol withdrawal is relatively common, affecting about 50% of people who struggle with an alcohol use disorder. Since it is so common, the effects of withdrawal can range from very mild to life-threatening. Mild symptoms include sweating, tremors, headache, and irritability or anxiety. Moderate symptoms include high blood pressure, hallucinations, and heart palpitations. While more severe symptoms could include seizures, confusion, and delirium. When the symptoms are severe, this is known as delirium tremens, which is a life-threatening condition. So let's take a look at delirium tremens. This is an extreme form of alcohol withdrawal that will require hospitalization and needs to be monitored closely since it can be life-threatening as well. When there's a severe alcohol addiction, the central nervous system adapts to when there is alcohol in the system versus when there isn't. When a person cuts that alcohol completely, the central nervous system is still in that state that it would be if alcohol was present. Therefore, it can't regulate itself back to homeostasis. Symptoms here are seen within the first 1 to 3 days, completely sober, but worsen rapidly in days 4 and 5. These symptoms include psychosis, seizures, hypothermia, tremors, shakes, and confusion. If someone is experiencing delirium tremens, they will need to seek medical help as soon as possible. But what should someone do if they're dealing with recovering in a mild or moderate way? The first step would be to encourage them to seek help. This can range from detox, therapy, and support groups, and they will want to help themselves, so encouraging them will be that first step. Avoid enabling behaviors, such as covering for their drinking or dismissing that they are struggling. If they do seek professional help, there are a bunch of different routes they could take, some of which are follows. Doing a medical detox, this consists of a supervised withdrawal for severe cases. Using a medication, some common types are naltrexone, which reduces cravings, and dysphoria, which causes sickness when drinking. They can also seek help through therapy and support groups. Cognitive behavioral therapy or motivational interviewing are common types of therapy used. Support groups including AA or Smart Recovery are popular groups and are relatively easy to find nearby. Lastly, a lifestyle change should also be made, including using healthy coping lifestyles, avoiding those triggers, and ultimately setting themselves up for success. We just want to say thank you for watching, and we hope you learned something today from our presentation on drugs and alcohol.